Hello and welcome. I'm here again with Mark Aitken, Stakeholder Engagement Manager at Nurse and Midwife Support, or NM Support. Mark, thank you for taking the time to have another quick chat today on the topic of wellbeing during a crisis. What a timely topic to be discussing.
Absolutely, Zoe. Hello, great to be here with you and to talk about one of my favourite subjects, the health and wellbeing of nurses and midwives.
So let's kick off, Mark. Tell us just how important is health and wellbeing for nurses and midwives?
Well, it's absolutely vitally important, Zoe, because I often pose the question that how can we adequately care for others if we don't care for ourselves? And indeed, the health and wellbeing and self-care of nurses and midwives is a requirement of the Nursing Midwifery Board of Australia Code of Conduct for nurses and the Nursing Midwifery Board of Australia Code of Conduct for midwives. And the code actually states that nurses promote health and well-being for people and their families, colleagues, the broader community and themselves in a way that addresses health inequality, and that we act to reduce the effect of fatigue and stress on our health and on our ability to provide safe care. So I say that you should fundamentally be engaging in your own self-care for your own well-being. But indeed, if you needed another reason to do it, our actual code of conduct requires us to do that.
Great point. And Mark, what do we know about the impact of stress on our health and well-being?
Yeah, well, stress really has a very big impact on health and well-being. There's, of course, an element of stress in life that we all have. There's day-to-day stress and that we all experience that. Sometimes I think we can find that exhilarating, it's short, it's a burst of stress or adrenaline or indeed hormones that actually propel us into action. And I don't know about you, but I often feel exhilarated by that. So do many nurses and midwives I talk to.
Yeah.
It's a bit like endorphins that you get released sometimes when you exercise, is that they can really make you feel great, and then you've jumped into action, and then you've dealt with the issue that you need to deal with, and then you bring your stress levels go back to a normal response. The problem for many nurses and midwives is that they get into a unhealthy stress zone, or what I say is they get into the red zone. So I like to visualize stress in relation to a thermometer. So there's green, there's everyday stress and life is just ticking along. Then there's yellow, and that's like warning signs that start to tell us that the stress is not good for us and it's not a healthy place to be. And then there's red zone stress, which is actually prolonged or chronic stress, which is really depleting for people. It's draining. It can cause stress and anxiety and despair for people. And it actually can mean that you stop enjoying the everyday things in life that make your heart sing and assist you to enjoy being a human living in the world.
So, Mark, when someone rings nurse midwife support, what are the sort of strategies and tips that that we can put forward and offer to really try and reduce the negative impacts of that stress on the health and well-being of nurses and midwives?
Well, the first thing we do, Zoe, is we would acknowledge the stress for that person, and we'd acknowledge that their experience or the response is a normal way to feel. And we would talk to them that there is support available and a way to reduce negative impacts of stress. I think that's really validating for people, that they know there is support and help available. So we try and assist them to understand their stress and what their triggers are. And then we talk to them about things in their life that they may do to reduce that stress or bring themselves back to a healthy green zone stress level. And part of that is self-care. We think that self-care is vitally important for the health and well-being of nurses and midwives. And indeed, often when you're in the care and service of other people, you're often not very good at putting your own self-care or health and well-being first. So we say that self-care is any activity that we do deliberately in order to take care of our mental, emotional, and physical health. It's a simple concept in theory, but it's something we very often overlook as nurses and midwives. And good self-care is key to improve mood and reduced anxiety. It's also really good in relation to having an effective relationship with yourself and other people and those around you.
Mark, what exactly constitutes self-care, and how do you make it a part of your daily routine, both at work or in your personal life? What are things that we can do to really ingrain that?
Yeah, well, self-care needs to be intentional. It needs to be something that you set for yourself as a soothing activity or an activity that makes you happy or content or enables you to, fill that cup up. Fill the glass up so that it's not half empty or almost empty. It's actually full and you feel good about your life, yourself, and the people around you. So sometimes that requires us to reflect on those things and to indeed set goals for our own self-care. So what works for me, Zoe, in relation to my self-care may not work for you. So we need to have some reflection on this issue. As I said, set the self-care goals. And what we encourage people to do is actually write those goals down. We encourage people to develop their own self-care plan so that, if you write it down, if you set goals, if you schedule your self-care activities, then you're more likely to do those things. And indeed, if you share those intentions and those things with people around you and you talk to them, communicate to them about the importance of those things to your health and well-being, then it's more likely that those people around you will have a shared understanding of the importance of self-care for your well-being and will support you being able to do that. So very recently, Nurse and Midwife Support collaborated with the Nurse and Midwifery Health Program at Victoria, and we developed, and indeed AusMed, and we developed in collaboration some great self-care, health and wellbeing resources. There's a survey that we've developed, so you can undertake the health and wellbeing survey. That survey then allows you to populate your own self-care plan. And there's a health and wellbeing resource toolkit with some really good resources that will be able to help you commit to and undertake your self-care. So you can get those resources via the NMHPV website. And indeed, very shortly, I know, Zoe, you'll be able to access those through the AusMed website as well.
Fantastic. And we'll put the links to all of these resources up with this quick chat. But I love the term. Isn't it just brilliant? A self-wellbeing plan. As you said, we write care plans for others. We write learning plans. Why wouldn't we put our own health and well-being or our own self-care plan together? It just makes sense, doesn't it, Mark?
Yeah, it's actually a basic concept, but it's not something nurses and midwives traditionally do for themselves. And I've reflected on that. And I think, as I said before, I think when you're in the care and service of other people, you're not actually often very good at caring for yourself.
Absolutely. Well, on that note, I hope we've inspired those of you who have listened and or read this transcript of our quick chat to, in fact, reflect on your own self-care, your own health and well-being. And once again, Mark, thank you very much for taking the time to sit down and have a quick chat with us today. And thank you on behalf of all of our nurses and midwives and students for really looking after our own health and well-being, particularly at this time during a crisis. It's just so important, and we can't thank you enough.
Oh, my pleasure, Zoe. And if anyone wants to phone the service, 1-800-667-877, they can actually talk through these issues with a nurse or a midwife who will answer your call. So please do that and look after yourself and each other, because your health matters.
Thanks, Mark.
Thanks, Zoe.